Hello, and welcome to the Community Health Training Institute's 2019-2020 training calendar. My name is Gina Rodriguez, and we're going to be walking through all of the trainings that we have going on this year, and also share some new and exciting things that we have to offer. So let's jump right into it. The Community Health Training Institute is a project of the Massachusetts Department of Public Health and Health Resources in Action. The Massachusetts Department of Public Health, or DPH, is not only our partner in this work, but they're also our funder. So thanks to their generous funding, all of the offerings that we have this year are absolutely free. Health Resources in Action is where we work. It's our organization. We are a nonprofit public health organization whose offices are located in Boston, Massachusetts. But as a training institute, we do work all across the state. And as an organization, we do work all across the nation. Our mission and vision here at the Training Institute is to increase the capacity and skills of community health leaders and stakeholders to build and sustain coalitions and partnerships that support healthy communities and improve health outcomes across the state of Massachusetts. This is our team here at the Training Institute. Daisy Ortega serves as our director. Myself, Gina Rodriguez, I am the project manager. Kelly Dankert is our training associate, and Tanayo Crow is our administrative assistant. Here's a small selection of our partners. These are organizations that we work with across the state of Massachusetts to help deliver our trainings and our content. So that's a little bit about us. Let's jump into some of our coalitions. What is a coalition? So throughout this presentation, you'll hear us say coalition. On our website, we list a bunch of coalitions, more to come on that as well. So when we say coalition, we mean all of these things. So if you call yourself an alliance, a collaborative, a task force, a working group, a commission, a council, these words are all interchangeable for us when we say coalition. We are a training institute, so we want to be seen as a resource for coalitions across the state so that you can build your skills and capacity to become better at your work and to also meet what we call the Coalition Engagement Principles and Guidelines. Now, these are released by the Massachusetts Department of Public Health for coalitions to meet. Now, they include things like a statement of purpose and shared activities, defined leadership, membership that is reflective of the community, and so on. And so all of our trainings not only have detailed training descriptions and learning objectives, but at the bottom of each training description, you'll notice that will list which coalition engagement principles and guidelines will be addressed in each training. So if you wanted to build up your defined coalition member roles or your statement of purpose and shared activities, the training that you're interested in, you would scroll to the bottom and see if those specific guidelines will be addressed in those trainings. The reason we want coalitions and community groups to build up their skills so that they can meet these engagement principles and guidelines is so they can access resources and funds that are released by the Massachusetts Department of Public Health. Because of our partnership with them, they look for some of these things when they're engaging with coalitions. They want to make sure that you're meeting these principles and guidelines, that you're listed on our website, on our coalition finder, which we'll go over in a second, and that you've attended some of our trainings. They do look for that as well. Now, our coalitions. So our website, hrainstitute.org, houses the only coalition database for the state of Massachusetts. Currently, we have 415 coalitions listed on our website, which you'll see here on the map. This is the breakdown by region. And what you'll notice is there are some gaps in the state and that we hope to fill in our work throughout the year. So if you go on our website, please add your coalition to our coalition finder. It takes just a few minutes. We want to be able to engage with coalitions and groups all across the state and be able to fill those gaps. Community engagement. How can we best serve you? So as I said, we want to be able to engage with you and your work better, and want to know how best we can serve you. So if you have an event going on or a meeting that you'd like us to attend, something that you want us to share in our newsletter or website, please email us with those opportunities. We want to get to know our coalitions better and the communities that you serve. Great, so let's jump into these trainings. We have 8 brand new trainings this year and 4 revised trainings that we're really excited to offer. Just a note about our revised trainings. At the end of each training that we do, we hand out feedback forms, and you all give us some really great feedback for our trainings, and we use that information to revise and tweak or offer brand new trainings based on what you're telling us, so that we want to make sure that the topics and all the things that we're covering are relevant to the work that you're doing. So thank you if you've come to our trainings and filled out a feedback form. We really do look at them and we find them really helpful. One new thing that you'll notice this year is our online trainings are going to be more conversation-based trainings, almost a podcast style conversation that's happening between the moderator and the trainer. They'll be shortened in length as well. They used to be an hour and a half. Now they're going to be an hour long. They'll also be hosted on the Zoom platform, which is available as a mobile app. So perhaps it's going to be a more engaging process, something that you can listen to on your way to work or during a lunch hour. We want to be able to engage our audience a little bit better. And we hope that these conversation-based online trainings that are shortened give us that opportunity to do so. So let's jump into the fall. Coming up in September, we have Navigating COMM-BUYS, which is a pre-recorded webinar. As mentioned, DPH is one of our partners, and COMM-BUYS is a website where organizations and coalitions can go to apply for funds and resources and submit proposals. So this will be a pre-recorded webinar to help you navigate their website, how to apply, and some tips and tricks for that as well. So that's coming up in September. In September, we also have our 2019 Health Equity Cohort Reunion, which is an in-person training only open to our cohort members that took place in our first Health Equity Cohort, which was a huge success. So we're bringing that group back together again to learn more about how they've been able to apply what they've learned in their work, and hopefully get some more feedback for our cohort that's coming up next year. In October, we have dynamic facilitation. What are ways that you can improve your facilitation, build better agendas, and reach hard to engage members as well? In October, we also have Utilizing the Public Health Information Tool, or FIT. This is another pre-recorded webinar for another DPH website. FIT is a tool where you can access community health data across the state of Massachusetts. So this website will walk you through how to use that website for your own work. And then rounding out our fall, we have Introduction to Motivational Interviewing. What are ways that you can use motivational interviewing as a tool to engage residents and community members? We have our winter trainings. Because we recognize that winters in New England can be quite tough to travel in, all of our winter offerings are online trainings, which are these shortened conversation style trainings, so keep that in mind. First up, we have Strategies for Addressing LGBTQIA+ Health Disparities. This webinar will go over what all these things mean, define some of these terms, and what are ways that we can be more inclusive in our work so that we can help address some of the health disparities that plague these communities. We also have Using Twitter to Promote Your Message. Twitter is one of the main social media platforms that we use here at the Training Institute, and we find it really helpful for our work. So what are some tips and tricks that we can use Twitter to promote our own messaging for our own work? And then last but not least, rounding out our winter, we have Chatting About CHIPS. Understanding the DON process, or the Determination of Need process, which is a process between organizations, communities, and their local hospitals, and what are ways that you can tap into some of the work that's already happening, and some of the resources that are available to those communities as well. Spring 2020, we have Examining Our Own Privilege, How to Move from Ally to Accomplice. This is an in-person training. This is one that we're really excited about. It's one that's revised because we want to be able to continue to build on the work that we're doing. This is revised from our racial equity work. So what are ways that we can continue to move forward in our work and move from ally to accomplice in the work that we're doing. We also have Organizing for Environmental Justice. How does our environment impact our health? The environment in our communities, the built environment that we've all been a part of, or not? How can we organize for environmental justice in those spaces? We have Dismantling Structural Racism to Advance Health Equity. This is another really popular training that we continue to revise and tweak to make sure that we're on the cutting edge of what's happening in the health equity world and continuing to have these conversations. And last, for our spring, we have Lasting Impact, How to Engage Your Community and Make Your Coalition Work Meaningful. Another revised training that we're really excited to offer this year. Coalition work is always ever changing. So what are ways that we can make sure that we're keeping our community engaged in that process? As the work changes, as our community changes, we want to be able to stay abreast of all the things that are happening. So that's our public trainings this year. Now we're going to get into the cohorts that we're offering. We have 2 new training cohorts. We're bringing back our health equity cohort. We're updating it a little bit. And we also have a brand new coalition building cohort. Applications for both of these cohorts will open in September, so be on the lookout for those. They will be on our website, on our blog, more information to come on that as well. You might be asking yourself, what is a cohort? A cohort is a network that connects public health workers and coalition leaders across the state to promote healthy communities. If you are a coalition member, a leader of a coalition, we want to bring together people that are working towards creating healthier communities, so that you're attending this training with the same people, sort of moving and learning with them and with the trainers as well, to build on that knowledge and promote health equity and what it looks like in this work. This is a quick overview of our health equity cohort this year, which will be led by Mo Barboza and Natalie Cashin of Health Resources in Action. And these are some of the training titles. We have Unpacking Our Biases to Advance Health Equity Then and Now, and Addressing White Fragility. We'll also have some facilitated networking opportunities that happen in between all of our sessions, just to build community between all the cohort members, and talk about what this work is really looking like on the ground level. And for our coalition building cohort, it will be led by myself, Gina Rodriguez, and Kelly Dankert, our training associate, also of Health Resources in Action. And the training titles for this cohort are Coalition Basics, Overcoming Obstacles, Recruitment, Retention, and Reactivation. And then last but not least, Challenging the Status Quo and Embracing Change. We're really excited about this offering and offering a new cohort this year. So more information to come, applications to be released in September. Be on the lookout on our website, our blog, and our newsletter. Speaking of our newsletter and our website, we want you to come visit us, hriainstitute.org. We have tons and tons of resources, news articles, lots for you to explore. Our website is not static. We constantly update that information. So please come visit us, check it out, take a look at the toolkits that we offer, the resources, our webinar library, our newsletter library. There's all of it right at the click of your mouse. We're really excited again, continue to update that information. And also, please visit our coalition finder so you can add your coalition. And if you're already there, make sure that your information is up to date as well. hrainstitute.org. As mentioned, our newsletter is really important. It reaches over 3,500 people across the country, not just Massachusetts. We list resources, community health news articles, training opportunities, job and funding opportunities. So it can feel big when you get it in your email, but it's because we jam pack it with all of these resources that we think are really useful for this work, and that people are constantly looking for. It's all in one place. So if you are interested in what we've posted in the past, we always host our past newsletters on our website as well. So you can look through those too. This is what our coalition finder looks like on our website. So as mentioned, if you want to add your information, it's very simple. You're just adding your name, your email, phone, etc., and really just takes just a few minutes. And you can also search for other coalitions doing the work that you're doing, or perhaps a coalition that's geographically in your area that you want to connect with. We want to be able to continue to build our database, so please visit our website so you can add your information and also take a look at what we have to offer as well. We have an online presence and we want to be able to connect with you. We want you to join our conversations, share resources with us, tag us in what you have coming up. We often take part in Twitter chats, so tweet at us at HRA Institute. We want to hear from you, and we want to share what you've got going on as well. What are ways that you can contact us? Here it is. You can reach us at Twitter, as mentioned, at HRA Institute. You can reach us on our website, hrainstitute.org. You can email us, traininginstitute@hra.org, or you can join our LinkedIn community, which is Community Health Training Institute Group on LinkedIn. And you can find us individually as well. So if you wanted to search myself or Kelly or Tanayo, we're all on LinkedIn. So please, please search us. Thank you so much, and we hope to see you at our next training.